Hello, dear students. Now we will be learning today is the glass ionomer cement. As the name suggests, glass ionomer. Now, from where this term has been arrived. So, the cement is glass ionomer cement. The glass word is from the main ingredient of the powder is the glass, and the setting and the bonding reaction to the tooth involve the ionic bonding. That is the silica particle. That is the glass, and the ionic bonding. That's why it is a glass ionomer cement, and this has replaced many of the cements, and today this is the most popular and the most commonly used cement. So this is very important for the examination point of view, long answer point of view. Everything is important for the glass enamel cement. So let us begin it in detail. So these all things that you should know about the glass enamel cement. So it is an acid-base reaction type of the cement. It is tooth-colored. The first tooth-colored cement that we have seen was the silicate cement. Then it is a truly adhesive. The first one was zinc polycarboxylate cement. The special properties of it are it is excellent biocompatible. Then direct chemical bonding with the tooth structure, anti-erogenic property. It is porcelain-like translucency that is used as a tooth-colored material. Favorable bioactive properties, and it is used as a bone substitute. We will see it in a subsequent slide. Now, GIC was first prepared by Dr. Wilson and Kent in 1972. This is an MCQ question. And its first clinical use was reported by Ms. Dr. Maclean and Dr. Wilson. So you should know about the author's name related to this cement. Now, these cements are having a different synonyms. That is aspa cement. That is nothing but aluminosilicate polyacrylate cement. Then glass polyalkanoate, dentine substitute, and man-made dentine. So this is all about the synonyms of the GIC. Now, the familiar picture, you must have been knowing now this. This is an acid-base reaction type of the cement. It is a tooth color, chemically adhering to the tooth, and the pH is mild. Let's have a quick look on AD numbers, AD specification numbers of all the cement that we have been covered. That is zinc oxide original 30, zinc phosphate 96, silicate 9 and 96, zinc polycarboxylate 61, and GIC 66. Now, whenever you are learning the glass animal cement, I just request you to please go through silicate cement first and zinc polycarboxylate cement first, because many of the composition of the powder, the composition of the liquid of the zinc polycarboxylate are same with the GIC. Even many of the properties of the silicate and the zinc polycarboxylate cement are seen in the GIC. So it is better if you go through these two cement first and then you learn the glass enamel cement. So according to the ADS specification, there are three main types. That is luting cement, that is to lute the crown to cement the indirect restoration. Restorative, that is used as a restoration, that is a filling of the cavities. Then type 3, cavity liner and cement base, that is just above the pulp, that is a depending upon the reparative dentin thickness, you give a base or a liner. So this is a type 3 type. And rest of the types according to the uses are type 4 is a fissure sealant, means in some of the patients, the teeth, the pit and fissures are very deep. They are very constricted. They allow very the food lodgement, and that may cause that means such type of the fissures, they are caries prone. So to seal these deep fissures, you can use the glass enamel cement type 4. According for the cementation of the orthodontic bands and brackets, you can use type 5 type of the orthodontic cement of GIC. Then type 6, that is pore buildup, means if you want to give a crown to the tooth and sometimes the tooth is badly broken, so you don't have a tooth structure to take a support for the crown. So for such cases, you can build a crown with the help of the glass enamel cement. So the type 6 can be used as a pore buildup material. Type 7, which is having a fluoride releasing cement. And type 7 is a ART, that is all traumatic restorative technique. All traumatic restorative technique means what? Without using any type of the rotary instrument, you just use a hand instrument to clean the cavity, and you just restore the tooth cavity with the ART restorative material. You just have to fill the cavity and just remove the extra material. That is all about the traumatic restorative. You are not harming or you are not using any type of the restorative, any type of the rotary instrument for doing the restoration. Then last is the type 9, that is a deciduous teeth to restore the deciduous teeth of the patient. So there are a total 9 types which are most commonly asked in the vivas or in the examination. So you should know this. Type 3, 1, 2, 3 is ADA specific according to the ADA specification, and rest of the type 6. Rest of the type that is 1, 2, 3, 4. Rest of this there is total 6 numbers. Next to 3 are other according to the user. Now it is supplied in a 3 form, that is a powder liquid system in 2 different bottles. Then single component system, as we have seen in a zinc polycarboxylate, where the liquid component is freeze dried, it is grind into the powder, and the same is content is added into the powder bottle. So that is in a 1 bottle, powder and liquid both in a powder form. And when you want to mix it, you will have to just mix it with the distilled water. Then third is a pre-proportion capsule, means in the compartment, one compartment contains the powder, one compartment contains the liquid, and you will have to mix it mechanically. Then the middle, the membrane that is separating the powder and liquid is broken down and it mixed. Likewise, your silver amalgam. So you can see here, this is a GIC type 1, this is GIC type 2, and this is a capsule form. Now let us come to the composition. The composition is very similar to your silicate cement. If you go through it, that is silica, alumina, aluminum fluoride, calcium fluoride, sodium fluoride, and aluminum phosphate. And the liquid component is 45 to 50% aqueous solution. Just remember the word aqueous solution of polyacids containing polyacrylic acid and its copolymers like itaconic acid, malic acid, and tricarboxylic acid. Now these polyacids have many reactive carboxylic groups, and these groups are important because they chemically bond with the tooth enamel and the dentin collagen to give you chemical adhesion. Now these ions, they decrease the viscosity of the liquid because if you remember in the zinc polycarboxylate, we've seen that the polyacrylic acid, the viscosity is increased, means it gels down. So it decreases the viscosity. These 3 ions, they decreases the viscosity and also decrease tendency to undergo thickening by gelation due to the intermolecular hydrogen bonding. The next important liquid content is the tartaric acid, which is around 5 to 10%, and this is important to increase the working time and to decrease the setting time, and it also prevents the thickening of the liquid during the storage. In one of the MHS examination, the role of malic acid is asked in the MCQ, so please remember this. Now coming to the setting reaction, which is very, very important. Many a times long answer question has came in the MHS examination or the setting reaction of the glass ionomer cement. So yes, this is an acid-base reaction type of the cement, and you will be watching the reaction in 4 different steps. That is a dissolution, initial setting, that is a calcium cross-linking, then final setting, that is aluminum cross-linking, and a maturation. Now first is the dissolution. Now when the powder and liquid are mixed together, the acid from the liquid, they attack the glass particles, and there is a leaching of the calcium, aluminum, sodium, and fluoride ions into the aqueous solution. This is very similar to the silicate cement that we have seen. You can see in the picture the glass particle, when the acid attacks, when the polyacrylic acid attacks, there is a leaching of all the ions into the aqueous solution. Now, in the second reaction, what happens? In the initial setting, that is a calcium cross-linking occurs. The polyacrylic acid chain gets cross-linked by the calcium ions during the initial setting reaction in the first 4 to 10 minutes from the start of the mix. Now, since these calcium ions are doubly charged, you can see the charging ion is a doubly charged, and it is a ionic type of a bonding to the glass particle, and that's why they are easily liberated by the ion exchange with the hydrogen ions of the acid, and they are responsible for the initial cross-link. Because of the double charge and they are ionic type of the bonding, so it gets very easily cross-linked initially. And during this initial stage, the material is very easily carvable like your amalgam. But at this stage, you have to take care of your cement because it is highly susceptible to the moisture contamination or the water absorption. So once you did the filling with this GIC, you will have to coat your restoration either with the varnish or with the Vaseline. so that there should not be moisture contamination. If it occurs in these stages, there may be breakage of this um, that is the reaction that is seen. You can see in here that is the calcium ions plus the polyacrylic acid. There is a formation of the calcium salt, so it can be leach out from this. This cross linking can break down if the water contamination occurs. So you will have to coat your restoration with the cavity varnish or with the Vaseline. Now the next is the final setting. Now in this reaction, the gelation occurs during the next 24 hours when the less mobile trivalent aluminum ions cross-link with the polyacid chain. Okay, means this is the, you can see this is the trivalent and it cross-link with the polyacid chain. Now, as the aluminium is covalently bonded, now we have seen in the first reaction that the calcium is ionic bonding. That's why it is very easily cross-linked initially. But aluminium is covalently bonded to the glass and they can be liberated by slower hydrolysis, and that's why these ions are very less mobile and they release much later than the initial ions. Means first, because of the covalent bonding, they are less mobile and they leach out very slowly and the later stages. In the first stages, the calcium ions are leaching out. Because of the ionic bonding is double charge. Here they are triple charge, covalently bonded. That's why they are releasing very slowly. Okay. Now, as the hydrolysis continues, these ions release more of, as the hydrolysis continues, there is a release of more aluminum ions, silicate ions, and the silicate forms the silica gel, while the aluminum ion chelates with the carboxylic group and displaces even the calcium ions which was initially bonded, because the aluminum ions have the higher charge as compared to the calcium and they are stronger and gives a stronger bonding, and that's why they increase the final strength of the set cement. Okay, so this way you can see this how the reaction occurs, and these are the carboxylic group, they bond with this, and you can see there are many of the free carboxylic groups still present in the reaction. Now where this is involved means where the reaction occurs with this free these carboxylic ions, we will see in the next slide. Now you can see in the reaction, it is similar to your the reaction that we have seen in a zinc polycarboxylate, where there was only instead of aluminum ion there was a zinc ion and it is combining with the all this carboxylic group. Now the sodium and fluoride that is left in the reaction, they do not take part in the cross-linking of the set cement. Some of the sodium ions may replace the hydrogen ion of the carboxylic group, whereas the remaining ions along with the fluoride ions are dispersed uniformly within the set cement, which gives you the anti-kerogenic property. Okay, so this is all about your the dissolution step, initial setting and the final setting. Now the last step is the maturation and the structure of the set cement, that is the maturation stage. The calcium and the aluminum polyacrylate cross-link chains, they become hydrated with the water which is present in the liquid. That's why this process is called as the maturation stage. And in the set cement, you can see the white inner part, that is the 4 particles which are the unreacted glass, and it is covered with the silica gel, and you can see the matrix of calcium and aluminum polyacrylate, that is the in the initial mix and the final set cement. So this is a matrix, or this is a matrix made of calcium and aluminum polyacrylate. In short, the reaction can be glass powder with plus all the polyacids, that is all the liquid components. They form the polysalt gel, that is the calcium polyacrylate and the aluminum polyacrylate, plus the gel, silica gel, which is bounded on the unreacted core particles of the glass particle. Now, very important is the role of reactor. Now, in the first step that we have said, that is in the initial reaction, we said that you will have to take care of your restoration. You have to coat the restoration with the help of the Vaseline or the your cavity varnish. So here comes the role of water here, that GICs are a water-based cement, because In the GIC, the water constituents around 11 to 24% of the set cement. So water plays a critical role in the setting reaction of the GIC. It initially serves as a reaction medium and then it slowly hydrates the cross-linked matrix. Means initially it is a reaction medium in the initial setting period, and after that it slowly hydrates the cross-linked matrix and thereby increases the strength of the mix in the initial setting. Okay, now we'll be we should write the role of the water in the two forms, that is a loosely bound water and the tightly bound water. Now what I said, that there is the 11 to 24% of the water is still present in the set cement and it is playing a critical role in the reaction. Means in the initial stages, the water is acting as a reaction medium and later on it slowly hydrates the cross-linked matrix. Okay, so during the initial setting, the water is loosely bound and it can be easily removed by the desiccation when exposed to ambient air or any contamination by the water at this stage can cause the dissolution of the matrix and causing the release of ions from the polyacrylate chain. Now, which ions will be released in the initial stages? Yes, that will be the calcium ions because the initial setting occurs with the calcium ions only. So that's why we are coating our restoration with the Vaseline in the initial stage. Okay, means otherwise if you are not coat and if there is a water contamination occurs, so this calcium ions maybe get diffused, or it may be get separated from the polyacrylate chain. Okay, now after that the same water hydrates the hydrates the cross-linked matrix and it gives you the strength to your matrix. Okay, and then after this hydration in the second stage, this water cannot be removed by the desiccation, and because there is a stable gel structure has occurred. This is and that loosely bound water is converted into the tightly bound water. Means as the setting continues, as the time goes on, there is a formation of this aluminum polyacrylate. So the same water is hydrating the matrix and it cannot be removed by the desiccation, and it gives a stable gel structure, and this is called a tightly bound water. Means the loosely bound water is only converted into the tightly bound water. So if I want to, whenever I teach my students about the role of water, I just give them a very simple example of cooking a rice. Okay, please don't mention it in any of your writing part. It is just to give you a simple example to understand where the loosely bound water goes and what is a tightly bound water, because it is very confusing for the student in your second year level. So I just give an example of cooking a rice. Dear students, when we cook a rice, what we do, we add a water in the rice and we just put on our gas. So during the steaming stage, if you see, you can see the rice particles and the water separated. And at this time, if I drain out the water, it is very easily I can drain out the water, and easily the rice particle can also be get removed when I turn my pan on in another container. So that is a loosely bound water. But as the time goes on and when my rice is totally cooked, at that time the same water has hydrated all the rice particles and they become swollen, and at that time I cannot take out water, separate the water and the rice particles. So that is a tightly bound water, means it has hydrated all these rice particles. So this is very simple to understand in the glass enamel cement also. The same principle is here only. So this is all about the setting reaction of the glass enamel cement. So I am ending here and we will see the next part, the next properties and rest of the things of the glass enamel cement in the second part of the glass enamel cement. Thank you.